So glad Dr. Boschert is on the show today from Utah Gastroenterology, because we are talking about an issue that so many of us are dealing with, and maybe you haven't heard the official term for it before. It's GERD, which, doctor, means what?
Gastroesophageal reflux disease. It's kind of a mouthful.
Lots of big words,
yeah.
But it boils down to?
Well, it's basically acid and bile in your stomach backing up into your esophagus.
And how many people do face that on a day-to-day basis?
Probably 10 to 20% of the American population has reflux on a regular basis.
What age do you usually notice it? Is it when you're pregnant? Can it be before that?
Good question. Some people see it in their children at a young age. Most people get it when they're adults. They tend to get it during pregnancy. They tend to get it as they get older, and as America gets more heavy and has problems with obesity, we're seeing more of it in our population who's obese.
All right, let's go back to the basics. How does it happen in your body?
So if you look at our picture up here on the screen, the end of the esophagus has a sphincter muscle called the lower esophageal sphincter, and that's kind of your valve, if you will, or the door to keep the acid in your stomach and not up in your esophagus. As we get older, or if we're pregnant, or if we're overweight, the sphincter is kind of overcome and acid comes up into your esophagus.
Affects 10 to 20% of the U.S. adult population. So if you're sitting at home going, that's me, I'm one of those.
Yeah.
What are symptoms? What are the most common symptoms people notice?
Well, we tend to think of heartburn as being the #1 symptom, but the other thing people talk about is regurgitation, or what some people call reflux. Nausea is pretty common, chest pain, coughing. Some people have trouble swallowing because they get ulcers or scar tissue in there that prevents the food from going down.
Do people treat this themselves for the most part, or usually call a doctor?
I think it's okay to take something, an antacid or maybe some over-the-counter medication if you have heartburn once in a while. But if you're having heartburn more than once or twice a week on a regular basis, you really should be treated by a physician.
Well, and very popular medications out there that I'm sure everyone's seen the ads for. Right. And those work sometimes, but not in every case?
It depends, I think, again, sort of how severe your reflux is. Some people have minimal heartburn, and some people have really severe heartburn. And you have everything from antacids like Tums or Maalox to things like Zantac or Pepcid, which are H2 blockers. Those are an older drug. And now the new thing the last few decades has been omeprazole or Prilosec and the other drugs in that class. And so those are the most effective.
How do you know when that's not enough and when you should come and see you and say, it's too tough?
Yeah, that's a really good question. We get that a lot. I think the time that you want to really see somebody is if you've been on medication either from your primary care doc or from over the counter and you're not getting better, you should seek help. If you have what we call alarm symptoms, which is where food's getting stuck, or you're having bleeding, or you're having chest pain, or you're losing weight, that could be a sign of something more than just reflux, and you should get checked.
Talk about the picture we're seeing now.
So this picture here shows sort of the top of the picture where it's more white. That's the normal esophagus. Those red streaks are inflammation and irritation in the esophagus. And if you go to the next picture, you'll see, I'm sorry, go one more picture, please.
One more head, okay.
There you go. And that shows sort of that pale whitish looking area. That's what normal esophagus looks like. The pink stuff in the very center is the beginning of the stomach, and those white lines with the sort of reddish areas are ulcers in the esophagus. And that's what happens when you get bad acid reflux.
How serious can this get if left untreated?
Well, about 10 or 12% of people can get what you see right now, which is Barrett's esophagus. That's where you have stomach or intestinal cells going up into the esophagus, and that's called sort of precancerous. It's not always going to turn to cancer, but if you leave it too long, that's what happens. You get a cancer, and that's what you're seeing on that picture there, that big lump in the middle.
Finishing with the worst, right? That's not what you want to have happen.
So about 10% of people can get Barrett's, and about 10% of them may go on to have a risk of dysplasia or cancer in their lifetime.
Well, if this is something that you haven't thought about, or maybe you should, Utah Gastroenterology is the place to go. That's where Dr. Boschert is, and so many of his colleagues that do great work. Their website is right there on our screen, and we're going to link you from ours. Go to abc4.com/GTU, and we'll put all that information, valuable information, right there. Thank you for being on the show, Dr.